considered once an addict, always an addict. So there is no mainstreaming, they are a rejected group of the society, and this is how addicts were marginalized. But that is the reason we have to have a rehabilitation, putting them back to the mainstream. As we are discussing, this is a disease, but this is a very dangerous disease. And why do you need so much of skill and so much of rehabilitation? You can just pop in some pills, some medicines, or get some surgery to get out of a disease. No, this is a very difficult kind of a disease. It is called a fourfold disease. It affects the body, the mind, the social behavior, and of course the spiritual state. So you need so many service providers. Our project here, we follow the therapeutic community model basically. And we have doctors, psychologists, spiritual teachers, social workers, medical assistants, all as service providers. But the doctor is not the team leader. Basically the team leader is the senior peer motivators. Those who are in the recovery process, those who have done a long period of recovery, we have with us OB, 23 years of recovery, they are the leaders who guide the juniors to follow their path, because this is a very, very difficult, an addict goes through a lot of pain, he suffers like anything. See, if your body suffers, your mind suffers, if you are socially outcast, how much you suffer. And so we need many of very highly skillful people. And we also have our Guruji spiritual teachers, along with the Alcoholic Anonymous and the Narcotic Anonymous program, which is internationally followed. We follow the same program here very rigidly. We have also integrated our Guruji's program, which is helping the patients to stay away from psychotropic medication. We find in other centers and also with many doctors, medical professionals, all over India, we get patients from all over India and abroad also, that they are put on heavy doses of psychotropic medication. When an addict is identified, which causes a lot of cognitive impairment sometimes. They're so sleepy, drowsy, they're out of their intellectual deterioration starts. So this Sudarshan Kriya and this meditation, this process, once a person goes through, his requirement for medication comes